According to livescience.com, there are about 20,000 deaths due to COVID-19 in the U.S. right now. Now, I'm sure this isn't a topic you guys want to be listening to right now. I'm sure it's already taking up a lot of your conversations at home. But unfortunately, there are still people that do not understand the magnitude of this pandemic. There are still people that are going out and refusing to practice social distancing. And those people are kind of bothering me. So I decided to do some research and share with all of you my conclusion that I have found. Hi, my name is Carson C&T, and today I want to implore all of you to stay home during the coronavirus. So, the first main point that I want to make is that ignorance plays a big role in the spread of the coronavirus. So, some people just simply refuse to stay informed about just such current issues. If you're one of these people, then allow me to give you some statistics. According to Business Insider, all but 8 states, as of April 7th, all but 8 states have issued a statewide lockdown for their state. That means everyone needs to stay at home unless they have an essential outing to go to, like going to the grocery store or going to work. Our country's number of deaths due to COVID-19 has surpassed all other countries worldwide. And being uninformed also leads to rule breaking itself. When you don't know what the rules are, it's kind of difficult to follow them right. So there was a survey done of 100,000 people across all 50 states, conducted by Thomas Getz, who is the chief of research at GoodRx. And at least 15% of citizens didn't know what their state's current procedures were. And in some cases, at least half of those surveyed in a particular state were unaware of the instruction from their governor. So my advice to you is to get informed. Watch the news, both local and national, and stay up to date with what your government officials are suggesting or ordering you to do. My second point is that when you choose to stay home, you're not only protecting yourself, but you're protecting those in your community. It seems like a lot of younger people have little to no concern for getting this virus. A few weeks ago, thousands of college students were fleeing to Miami beaches to enjoy their spring break like they had planned to before the coronavirus was even a situation that they had to worry about. And when CBS News interviewed some of them, they were quoted as saying things like, "If I get corona, I get corona. This virus ain't that serious." And another student was quoted as saying, "It's really messing with my spring break," referring to all the bars closing down. While it is true that death from COVID-19 is much less common for younger people, there are still some cases. The Washington Post found that at least 45 deaths among people in their 20s, and then there were a total of at least 759 deaths among people under the age of 50 as of April 8th. So obviously this isn't a disease that is only affecting old people. While these numbers are significantly lower than the total number of deaths in the U.S., protecting yourself is not your only concern. While we, as young people, could most likely survive the virus, your grandparents, that old lady you run into at the grocery store, or someone with an underlying medical condition that you don't even know about, have much worse chances of survival, and their lives are worthy of protecting. My final point has to do with the quick spread of COVID-19. There is a video that has become increasingly popular that describes just how quickly this virus spreads and why that's an issue. It's an interview with Professor Hugh Montgomery, and he is the director of the Institute for Human Health and Performance at the University College London. In this video, he explains the difference between the spread of the flu and the spread of COVID-19. So he starts explaining that with the flu, on average, you would spread it to about 1.4 people, you yourself. So imagine you spread it to 1.4 people. Those 1.4 people spread it to 1.4 people. Each of those people spread it to 1.4 people, and that goes on 10 times. If that were to happen 10 times, you would have spread it to about 14 people. And in the case of COVID-19, on average, each person spreads it to 3 people. So if I spread it to 3 people, and then those 3 people spread it to 3 people, and then each of those people spread it to 3 people, if that happens 10 times in the same way, then I have been responsible for now 59,000 cases of COVID-19. So, Montgomery goes on to explain that not only does coronavirus spread much more easily than the flu, it also typically results in more severe cases. So, while there are some hospitalizations and there are definitely deaths recorded due to the flu, there are a significantly higher amount of hospitalizations and deaths due to COVID-19. What this means for us is that we have an obligation. You need to stay informed about the ever-changing news of this virus. You need to stop living like you're the only one affected by your actions, and you need to realize the magnitude and power of the virus. The best way for us to flatten the curve is by being obedient to government officials and what they're suggesting we do, and also just make wise choices that involve love and care for others and not just yourself. I say all this not to instill fear, but to help us all realize that we have a role in our communities, and even more importantly, we have a role as believers. Thank you for listening.